What if I told you that something most men over 60 never talk about or feel they're not supposed to talk about could actually improve your prostate health, help you sleep better, and even lower your stress levels? Yes, I'm talking about masturbation. Now, I know this might sound a little surprising, maybe even uncomfortable, but stick with me. Because the truth is, solo intimacy isn't just for young people. In fact, for older men, it can be a powerful natural way to support your health, your peace of mind, and even your confidence. I'm Dr. John. I've spent over 30 years as a urologist, helping older adults all across the country, men just like you, improve their health, regain energy, and feel more comfortable in their own skin. And one of the most overlooked conversations we need to have is this one. In today's video, I'm going to walk you through the real science-backed benefits of masturbation for older men. We'll break through the myths, talk honestly about how aging changes your body, and most importantly, I'll give you simple, respectful guidance you can actually use. If you appreciate straight talk without judgment and health advice that's actually helpful, feel free to hit that subscribe button. Now, let's get into it. Let's start with the elephant in the room. Most older men were raised in a time when the word masturbation wasn't just whispered, it was almost forbidden. Maybe you were told it was sinful, maybe you were told it would hurt your health, or maybe you just learned to never speak of it, even if it was a natural part of your life. Here's the truth. Millions of men in their 60s, 70s, and even 80s still masturbate, and not only is that normal, it's actually healthy. But because nobody talks about it, many of us are left feeling isolated, confused, or even ashamed. That silence, it can do more harm than good. Over the years, I've had many patients, strong, capable men in their retirement years, lean in and quietly ask, is it bad that I still do that? Or just as often, is it normal that I don't feel the urge anymore? These are fair questions, and they deserve honest answers. Let me tell you about one of my patients, Don. Don was 71, a retired bus driver widowed for several years. He came to see me for urinary issues, but what stuck with me was something he said as he was leaving the appointment. He paused, looked a little embarrassed, and said, "Doc, is it okay that I still, take care of myself sometimes?" He said it like he was confessing a crime, and I looked him right in the eye and said, "Don, it's not just okay. It might be helping your health more than you realize. Because here's what we know. Masturbation is a normal biological function. It's like stretching a tight muscle or brushing your teeth. It keeps things flowing, keeps the tissues healthy, and helps reduce built-up pressure physically and emotionally. The problem isn't the act itself, it's the shame wrapped around it. That shame can stop men from asking questions, from understanding their changing bodies, or from recognizing signs when something really is wrong, like an issue with the prostate bladder or sexual function. In fact, when we ignore this part of our health, we sometimes create bigger issues down the line. Not only that, but the isolation many older men feel, especially after losing a partner or adjusting to life after retirement, can quietly take a toll on both mental and physical well-being. Masturbation in this context can be a safe and private way to maintain a sense of connection with your body. It's not about fantasy, it's not about obsession, it's about maintenance, comfort, and yes, even dignity. And don't worry, this isn't about telling you how often or in what way. There's no magic number, and there's certainly no judgment. This is about helping you understand that your body's needs may evolve, but they don't disappear. And the more we shine light on topics like this, the more power we give back to older adults to feel in control, not confused. So if you've ever wondered, is it still okay, or should I stop? I want you to know you're not alone. Not at all. Now that's just the start. Because while it's good to break the silence, what's even better is understanding what this habit actually does for your health, especially your prostate. The science might surprise you. Let's dig into that next. Now let's talk about something that's on a lot of men's minds as they age: prostate health. Most men know that the prostate is important, but many don't realize just how much it influences everyday comfort things like frequent urination, interrupted sleep, and yes, even sexual function. What fewer people talk about is how regular ejaculation, including through masturbation, can actually support a healthier prostate. Let me break it down simply. Over the past couple decades, research has begun to uncover a fascinating connection. Men who ejaculate regularly tend to have a lower risk of developing prostate cancer. That's not a rumor, it's in the data. One of the most well-known studies on this topic comes from Harvard University. Researchers followed nearly 30,000 men over several years, tracking their sexual habits and prostate health. The result? Men who ejaculated 21 or more times per month, whether through sex or masturbation, had a significantly lower risk of developing prostate cancer than those who did it just a few times a month. Now I know what you're thinking. 21 times. Doc, I'm retired, not a teenager. Fair enough. But the point isn't to hit a magic number. The takeaway here is that ejaculation itself, regardless of how it may help flush out the prostate. Think of it like changing the oil in your car. You wouldn't let old oil sit and gunk up the engine. Right? Your prostate, in many ways, works the same. Ejaculation helps clear out fluids that can otherwise sit stagnant in the prostate ducts, potentially contributing to inflammation or other issues over time. But it's not just about cancer prevention. There's also evidence that regular ejaculation can reduce pressure inside the prostate. For men with benign prostatic hyperplasia BPH, that's the common non-cancerous enlargement of the prostate. This can sometimes help with symptoms like that frequent urgent need to pee, especially at night. One of my patients, Ray, was 68 and dealing with constant nighttime bathroom trips. He was already on medication, drinking less before bed, all the usual tricks, but still no relief. During a routine visit, I asked gently about his sexual health. Turns out, since his wife had passed away a few years prior, he had mostly given up on intimacy, even with himself. After we talked openly and he started reconnecting with his own needs, things changed. Within a few weeks, he told me he was waking up just once a night, sometimes not at all. That may not sound like a miracle cure, but if you've been up 4 or 5 times every night, getting real sleep again is life-changing. Now, let's be clear, masturbation is not a treatment for prostate issues. If you're experiencing discomfort, difficulty, urinating pain, or anything unusual, you should absolutely see a urologist. But for many healthy older men, regular ejaculation can be part of a proactive approach to staying well. And for those worried about whether it might cause harm, let me address a few common questions. Will it make my prostate larger? No, in fact, there's no evidence that masturbation causes prostate enlargement. BPH is caused by hormonal shifts and aging, not by sexual activity. Is it dangerous if I'm on medication? Typically, no. In fact, many medications prescribed for prostate issues don't interfere with sexual function at all. But if you're unsure, talk with your doctor and be honest. Trust me, we've heard it all before, and we're here to help, not judge. What if I just don't feel like doing it anymore? That's okay too. This isn't about forcing anything. Some men notice a drop in desire, and that's completely normal with age. But if you do still feel the urge or even just the curiosity, it's important to know it's not only acceptable, it might be beneficial. What matters most is understanding that this isn't about youth or performance. It's about keeping the machinery running in a way that's natural, private, and under your control. So to sum it up, regular healthy masturbation may help keep your prostate clear, reduce inflammation, support urinary comfort, and possibly lower cancer risk. Not bad for something we're usually too embarrassed to even mention, right? And guess what? We're just getting started. Because while the prostate benefits are important, there's another set of advantages that's just as powerful, especially as we get older. I'm talking about how masturbation can ease stress, help balance your hormones, and even help you sleep better. Let's dive into that next. Let's shift gears now, because beyond the physical side of prostate health, there's a deeper, often overlooked benefit to solo intimacy, how it affects your mind, your stress levels, and your sleep. If you've ever felt anxious, had trouble falling asleep, or found your mind racing, when your head hits the pillow, you're not alone. In fact, sleep disturbances and chronic stress are 2 of the most common complaints I hear from men over 60. What most don't realize is that masturbation done in a healthy, relaxed way can actually help regulate both. Let me explain how it works. When you orgasm, your body releases a cascade of neurochemicals. One of the main players is dopamine, a feel-good hormone that boosts your mood. You also get a release of oxytocin, sometimes called the cuddle hormone. Oxytocin helps calm the nervous system and increase a sense of trust and emotional connection, even when you're alone. And then there's prolactin, which rises after orgasm and promotes that drowsy, relaxed feeling you get afterward. It's nature's way of saying, time to rest. This combination doesn't just feel good, it helps your body recover. Your blood pressure may lower, your heart rate stabilizes, and your muscles relax. For many older men, especially those who've lost a partner or live alone, masturbation can be one of the few remaining outlets to trigger this kind of calming response naturally. I remember a patient named Carl, 69 years old, recently retired, and struggling to sleep more than 4 hours a night. He wasn't depressed, he wasn't in pain, just tired all the time. After a gentle conversation, he admitted that after his wife passed, he had stopped any form of intimacy. He thought it wasn't right to continue, but after we reframed it, not as a replacement for his wife, but as a form of self-care, he slowly began reconnecting with his own needs. Within a few weeks, he told me, "Doc, I'm sleeping better than I have in years. No medication, no sleep aids, just a more relaxed body and mind. Now, is masturbation a magic fix for insomnia?" Of course not, but can it help? For many men, the answer is yes, especially when combined with other healthy bedtime habits like turning off the TV early, dimming the lights, and creating a calm, quiet space. And it's not just about sleep. Chronic stress is linked to heart problems, weakened immunity, memory loss, and even faster aging. As we get older, we often face more emotional strain, changes in independence, health scares, family shifts, even loneliness. Finding safe, natural ways to lower stress is essential. Masturbation, when practiced mindfully and without guilt, can be part of that toolkit. There's also something important to say about control. As men age, we lose control over certain things. Joints ache, medications pile up, hearing isn't what it used to be. But one area where you can regain control is your relationship with your own body. Masturbation is a private, empowering way to stay connected, to remember that pleasure and relaxation aren't off limits just because of a birth date. Now, I want to be careful here. If you're feeling like masturbation is your only form of comfort, and you're using it to avoid emotional pain, grief, or loneliness, that's something to talk about. And I say that with all the compassion in the world. A good therapist or counselor, especially one who understands aging and sexuality, can help you work through those layers. There's no shame in asking for help. But if you're a healthy older man who still has the occasional urge and wonders, "Is this okay?" Let me be very clear. Not only is it okay, it may actually help your overall well-being. Here's a good rule of thumb I share with my patients. If you feel more relaxed, rested, or connected afterward, and you're not harming yourself or others, then what you're doing is probably healthy. You don't need permission, just information and a little encouragement. So, if you're having trouble falling asleep at night, or you find yourself overwhelmed during the day, and you haven't thought of this as a possible way to help, now, it's not about being naughty or inappropriate. It's about honoring your body, listening to what it needs, and letting it work with you, not against you. And remember, these benefits don't rely on frequency. You don't have to schedule it in or reach some target number. Whether it's once a month or once a week, the important thing is that it feels right for you. That brings us to a really common concern. What if you want to masturbate, but things don't work like they used to? Maybe your desire has dipped. Maybe your performance has changed. Or maybe you just don't feel confident anymore. That's perfectly normal. Let's talk next about what happens to desire and function as we age, and how you can work with those changes, not fight against them. Let's be honest. One of the biggest concerns older men have when it comes to intimacy, including masturbation, is simple. It doesn't work like it used to. And that's absolutely true, because aging does change things. But it's important to understand what's happening, why it's happening, and most importantly, that it's not your fault. First, let's talk about desire, or libido. It's completely normal for sexual desire to ebb and flow as we get older. Testosterone levels gradually decline over time. That doesn't mean they disappear, but you might not feel the same level of urgency or frequency you did in your 30s or 40s. That's natural. What's not helpful is the shame or fear that often comes along with it. Many men think, if I don't want it like I used to, is something wrong with me? The answer is not necessarily. See, desire in older age is less about hormones and more about connection to your body, to comfort, to safety, and to emotional well-being. If you're dealing with grief, depression, pain, or medications that affect your mood, it's understandable that desire might dip. But that doesn't mean it's gone forever. Sometimes all it takes is giving yourself permission to be curious again. Then there's the other side of the coin, function. One of the most common changes men notice is that erections aren't as firm or take longer to achieve. Sometimes they don't happen at all. Ejaculation might take more time. Orgasms may feel different, not as intense or not as quick. And I want you to hear this clearly. That doesn't mean you're broken. It means your body is adapting. Erections depend on blood flow, and as we age, blood vessels can narrow or stiffen. Conditions like diabetes, high blood pressure, or even common medications can all contribute. So can stress or performance anxiety. Your body and mind are deeply connected. If you're feeling anxious about whether things will work, it can actually interfere with your ability to relax and enjoy the experience. Let me share a story that might resonate. One of my longtime patients, George, was 74. He came into my office feeling defeated. "Doc," he said, "I tried to take care of myself the other night and nothing happened. I just stared at the ceiling and felt old." I asked him if he was in the mood when he started. He said no, but he used to be able to get going no matter what. That's a common pattern. When we're younger, the body takes the lead, but as we age, the mind needs to be more involved. For many older men, arousal becomes less about physical impulse and more about relaxation, imagination, and even tenderness. I suggested that instead of trying to make something happen, George could simply slow down, light some music, sit somewhere comfortable, no goals, no stopwatch, just reconnecting with the experience. A few weeks later, he came back and said, "That worked better than any pill I've tried." What changed wasn't just physical, it was his mindset. He gave himself permission to stop performing and start feeling. And here's something else that surprises a lot of men. Even if you can't get a full erection, you can still experience pleasure. In fact, some men say orgasms in their later years feel more emotional, more meaningful, even more peaceful. There's a different kind of richness that comes when you're not rushing or pressuring yourself. If you're struggling with confidence, remember this: you've spent a lifetime learning about your body. Now more than ever, it deserves kindness, not criticism. Touch doesn't have to be about proving anything. It can be about soothing, connecting, remembering you're still here, still you. And if you're dealing with more serious changes, like complete loss of function or persistent pain, please don't suffer in silence. Urologists like me are trained to help. We can rule out underlying issues, review your medications, and discuss options like therapy devices or treatments that make things easier. But we can't help if you don't speak up. I say this all the time in my practice. You are not alone. So many men your age are quietly wondering the same things. They just don't know it's okay to ask, but it is. So let me offer this reminder. There is no normal when it comes to aging and sexuality. There is only your normal. And if that includes masturbation, whether that's once a month or once a day, it's your private business. It's your comfort. It's your health. So don't let outdated ideas rob you of confidence. Don't let performance myths steal your peace. You've earned the right to be at home in your own body, no matter what age the calendar says. And now that we've covered the emotional and physical changes, let's finish strong with some simple practical tips for how to approach solo intimacy safely, comfortably, and with a little more ease. You ready? Let's wrap it up with some real-world advice. All right, now that we've talked about the emotional side, the physical changes, and the surprising health benefits, let's get into the nuts and bolts, how to approach masturbation in a way that feels safe, relaxed, and enjoyable. Because let's be honest, even if you're open to the idea, there's often that lingering question, am I doing this right for my age? So here's what I'd tell any patient sitting across from me in the office. There's no one-size-fits-all, but there are some helpful senior-friendly tips that can make the experience more comfortable and even more rewarding. Let's start with setting the stage. Your environment plays a big role in how relaxed you feel, and the more relaxed you are, the more easily your body can respond. If you're in a cold, cluttered room with distractions everywhere, it's harder to get in the right mindset. So try to set up a space that feels peaceful and private. Dim the lights. Play some soft music if that helps you unwind. Sit or lie down in a position that doesn't put stress on your back, hips, or shoulders. Use pillows. Create comfort, not pressure. Next, use lubrication. As we age, natural lubrication decreases, and not just for women. Older skin is thinner and more sensitive, which means friction can lead to discomfort, redness, or even tiny tears. Don't skip the lube. A gentle water-based or silicone-based lubricant can make a huge difference. You don't have to buy anything fancy. There are over-the-counter options at any pharmacy. Look for labels like personal lubricant, non-irritating, or for sensitive skin. Avoid using things like lotions, soaps, or petroleum jelly. They can irritate or even cause infections. Warm up slowly. You don't need to rush. In fact, the older we get, the more our bodies appreciate a little lead time. Take a few deep breaths. Let your hands explore gently. Don't expect an immediate reaction. Give your body the patience and presence it needs. And remember, arousal starts in the mind. Think about memories, feelings, or fantasies that make you feel good, whatever works for you. You're not wasting time by easing in. You're honoring your body's rhythm. Explore what feels good now, not what used to. One of the biggest traps older men fall into is comparing now to then. I used to be able to. It only took a minute back then. That kind of thinking takes you out of the moment. Instead, ask yourself, what feels good today? Is it a lighter touch, a slower pace, a different position? You're not broken, you're just changing, and that's okay. Many men find that sensations shift over time. For example, some notice they prefer more pressure, others prefer less. Some find that focusing on the full body, not just the genitals, brings more pleasure. There are no rules here. This is your private time to reconnect with what works for you. Post-orgasm care is just as important. After ejaculation, especially if it's been a while, you may feel tired, emotional, or even a little sore. That's normal. You've released tension physically and emotionally. Give yourself time to rest. Wash gently with warm water, pat dry, and rehydrate your body with water or tea. You don't need to bounce back. This is about self-care, not performance. Now, a few quick health notes before we wrap up this section. If you ever experience pain during or after ejaculation, or notice blood in your semen swelling, or a burning sensation, don't ignore it. These may be signs of infection, prostatitis, or other issues, and they're usually treatable. Just get checked out. Also, if you're using medications for heart problems, blood pressure, or mood, and you feel dizzy or overly fatigued after climax, let your doctor know. It could be a blood pressure dip or a medication side effect. One last note, sometimes after prostate surgery or radiation therapy, orgasm sensations can change dramatically. They may be dry orgasms, no fluid, or they may feel duller. That's not a failure, it's your body healing. Don't give up. With time, practice, and a little adaptation, many men find new ways to enjoy intimacy again, including solo. So, what's the takeaway? Be gentle, be curious, be kind to yourself. There is nothing wrong with wanting comfort, touch, or connection, even if it comes only from your own hands and heart. Whether you're just now opening up to this again after years, or you've quietly kept this part of yourself alive, I hope you now feel more informed, less alone, and a little more confident in your own skin. You've earned it. Next up, let's bring it all together, and I'll leave you with a few parting words that I hope will stay with you. So here's the bottom line. My friend, masturbation isn't just normal for older men, it can be nourishing. It's a simple act of self-care, comfort, and connection to the body you've lived in all these years. If this helped you feel more at ease, comment 1 below and share this with someone who needs to hear it. And remember, aging doesn't take away your right to feel good. You are still whole, still worthy, still you. Until next time, take care of yourself because you matter.